All right, so now we're going to go over manual stretches and what they look like exactly. I know that you hopefully have already gone over the PowerPoint over stretches, so you should have the concepts down hopefully, but I want to make sure that you see these stretches. So first we're going to do upper extremity stretches, and then we're going to do lower extremity stretches, and then I'm going to show you a few cervical stretches as well. And there will be times when we also talk about abdominal stretches and lumbar stretches, but that'll come later on. So first of all, we're going to start with the shoulder and the different ways that we can stretch the shoulder. So the key to stretching is that we're taking whatever muscles are shortened or tight and we're lengthening them. So what we're really doing is we are doing the opposite of whatever the action of that particular muscle or group of muscles does. So let's say Karen is not able to fully flex, extend your arm here, her shoulder up, okay, because she has tight shoulder extensors. So latissimus dorsi, posterior deltoid, and any of the other extensors might be tight. So the key here is that we want to move in the opposite direction of those tight muscles. So we want to increase flexion, we want to stretch the extensors, so we want to move her more into flexors. So most people don't have tight, and so the thing I'm going to have to do is just kind of show you they don't have tight shoulder flexors for normal folks. But normal range is 180 degrees, right? So Karen, as I do this, easily has that, and maybe she might even be a little bit hypermobile, which if we talk about our video, we don't ever want to go past. But how we stretch is we just want to stabilize, okay, around the joint and hold down and then bring to the point where they can't go any further, and then we just want to gently push a little bit further past that and hold it for 30 seconds. And then have them bring it down and relax. And we want to do that 30-second, and it can be 30 seconds to a minute if they can handle it. And that's really best. So bring it up, get it to that end range, then push it past, hold it for about 30 seconds, and then let them relax. And so the goal is each time you want to hopefully push it a little bit further. So in the case of flexion, the muscles along the back side of the shoulder here, your shoulder extensors have gotten tight, and we just want to make them looser by moving them further into their opposite motion. And so the key with any muscle, and a good trick to remember is even if you forget a specific stretch, it doesn't matter if you'll just stop and go, okay, wait, what muscles are tight and what actions do they do, and I'm just going to do the opposite of that action, and that's going to become really important later, especially with cervical stretches. So anyways, for shoulder, that's it. For shoulder flexion, you just go here and you push down. For shoulder extension, there are several different options, but if I have Karen scoot just to the edge just a little bit more, okay, so if she wasn't able to extend her arm, which she has plenty, so I'm just going to have her pretend, so kind of go down here, but because her shoulder flexors are tight, so possibly biceps, anterior deltoid, upper pectoral might be tight here as well, and so I would stabilize here, I would get her to the end range of motion, and I would push down further into that. The nice thing about this position is gravity helps you a little bit. Go ahead and scoot in just a little bit. So that's for extension. You can also have them lay prone to do that and lift up. The best thing though is you want to go ahead and scoot in just a little bit. So I'm going to put this kind of under your arm. I want you to lift your arm up for me. Make a fist for me. So you can also do extension and prone is what I was going to say. Just make sure that you position it well so your body can, but the whole point is just to move them further into whatever action is deficient. So if she can't fully extend her shoulder, push her more into extension. You're stretching the flexors and increasing extension. So we'll look at internal and external rotation now. So external rotation and internal rotation here, both are good on Karen, so I'm just going to have her once again pretend for us. So we're going to say she can only get to about right here. I would get her to that in range of motion, push for 30 seconds, 30 seconds to a minute again, then have her relax, come back, and then do that again. Like I said, you can do that for 3 to 5 times. An important thing to note is some patients will be so tight that it will be painful that they can't tolerate 30 seconds. If a patient cannot tolerate 30 seconds, you can do what's called cyclic stretching, which was referenced in your PowerPoint. But you can then have the patient just do it for 10 or 15 seconds, but do more sets of it. So I could have her hold for 10, 1, 2, 3, 4, 5, 6, 7, 8, 9, 10 for the stretch. Then have her come back, and instead of doing that just 3 to 5 times, I might do it 10 or 15 times. So the overall time that I'm stretching them ends up being the same, but for shorter bursts of stretching, so to speak. Research has shown that it's just as effective. So same thing with external rotation. I'm going to kind of stabilize here at the shoulder and then push down. I would get to that end range, hold for 30 seconds, and then relax, and then do it again. Okay. The only other shoulder abduction, you don't really stretch adduction, just so you know. It's not something that's really commonly a problem. If somebody can get down to their side and then maybe past a little bit, they should be okay. So it's not one that I'm going to really show you because we don't really do it. The only other one is shoulder. So I'm going to abduction, abduction. So I'm going to stabilize here. And Karen actually is a little bit tight in that. Not real bad, but a little bit. So I would get her to whatever her end range of motion. Just watch your hand placement here, especially with ladies. You want to let them know where you're about to touch them and make sure that they're okay with you touching, and just be careful not to get in to sensitive areas. So I would get to the end of the range of motion and hold it for 30 seconds and then bring it back down. Just make sure when you're moving them into abduction that their thumb is up and out, or at least pointing up here. You don't want them internally rotated at all because it will cause impingement of the shoulder.
I was internally rotated.
You were here. This is internally rotated.
Okay.
So just make sure you watch for that. But thumb up, once they get past 90 degrees, is the best way. So, the other things you can stretch here on the arm, and we can just keep her in this position for now. You can stretch the elbow extensors. So if somebody doesn't have enough flexion, they're limited in that because triceps are tight. You just would push them further into here. You can even put that more on a stretch if they're limited by bringing this here, and we're getting the long head of the triceps in as well. So same concept. We would first, and here's a trick that goes back to the PowerPoint with multi-joint muscles, muscles that cross. So for the triceps, it crosses both the shoulder and the elbow joint. You want to start with the lowest joint first, the more distal joint, and then move proximally. So if she were tight in her elbow extensors, I would move her more into flexion at the elbow joint first because it's the more distal. If she had enough of that, then I might increase here and give her a stretch along the long head of the triceps as well. That's going to be important as we deal with more muscles that cross joints, especially like with the hamstrings later on. So that would be for shoulder. So same thing with extension. This is a little more commonly seen, is you'll get a tight bicep where the patient has like held their arm in a sling for 6 weeks because they broke their shoulder or elbow or had some type of surgery. The biceps will get stuck in a flexed position, and so you would stabilize here, and you would want to push the arm here. So I would have her get to the end range of motion, push for 30 seconds, and then bring it back and go further down after that. Okay, you want to give a decent break in between, probably about a minute to two, for them to rest, for the muscle to relax, and for any pain that they've felt at all to kind of go away. As far as pain with stretching, it should be a discomfort, but not an extreme pain. It should never go past like a level 5 on that verbal scale that you guys learned in 150. So if it's hurting them too much, or especially if the hurt continues for more than a few minutes after you've stretched, you're stretching them too much and you need to back off a little bit. So that's elbow. So with the wrists, you can put a towel under the wrist here and here. So if she's tight, if her extensors are tight and she does not have full flexion, I'm just going to push her more into flexion. Same thing, hold it for 30 seconds, have her relax and bring it back. I can have her turn her hand over and go into extension, which she has plenty of, but same concept. I get to that end point and then I push past, hold for 30 seconds to a minute, and then have her relax. We can do the same thing with radial deviation. If the ulnar deviators are tight and she has reduced radial deviation, support here, push along the hand here, and bring her more into radial deviation to increase that range of motion. Same thing for ulnar deviation. Okay, so that's good.